Dr. Linda Camp, plastic and reconstructive surgeon here at Salem Regional Medical Center. This being October, Breast Cancer Awareness Month, I wanted to talk about breast health. So many women are not clear as to what good breast health practices they need to do. So most women would start getting a mammogram at age 40. That can be controversial. Many countries don't start mammograms until the age of 50, but when you realize that breast cancer can be caused by environment and diet, that is why different countries have different guidelines. Here in the United States, we do recommend that women start a mammogram at the age of 40 and at least by the age of 45. The National Cancer Society recommends a yearly mammogram. Different organizations have guidelines that would be used to recommend mammograms at different times for women, but typically every 1 to 2 years is a standard for the United States of America. And back in the 80s, 90s, breast cancer risk was maybe 9% of women, just healthy women without other risk. But that has slowly increased over time. Whether it's due to our environment or our diet, it is now thought to be 12.5% of women in the United States are at risk of developing breast cancer over their lifetime. So mammograms are a screening tool for people who do not have symptoms, but as a healthy breast management to check your breast for any abnormalities. Good breast health practices can also include a breast self-exam. Sometimes a physician would do a clinical breast exam. This practice can be controversial also. We know that findings sometimes lead to biopsies that might not prove to be an abnormal diagnosis. But if you are a patient who finds something unusual on breast self-exam, even when you're in the shower, it is something that should be brought to the attention of your physician. To understand how your breast feels on physical exam, it's best to do an exam the week after your menstrual cycle's complete. That way your breast has the least hormone influence. And if you did that, say this month, and consider that baseline or normal, then next month, after your menstrual cycle is complete, you do a breast exam. If there's something different that you feel, that would be the time to ask your physician to investigate and see if you might need another study to check out what that thing is that you're feeling. This being October and Breast Cancer Awareness Month, we just want to bring to the forefront good breast health practices. Whether it's encouraging you to get your mammogram, maybe you've fallen behind the schedule of good screening mammograms. We do have walk-in screenings in our Columbiana facility. Whether it's getting a first-time mammogram, and depending on your breast tissue, you might be a candidate for a digital mammogram or even a tomosynthesis for more dense breasts so that we have a better view of your breast parenchyma. And I did want to talk about women who have breast implants. When you go for mammogram, you need to tell your mammographer that you do have breast implants so they can do special views for identifying the most breast tissue possible. So this may be a good month to start those good breast health practices. If you find something abnormal, please see your primary care physician or schedule an appointment with me or one of our breast surgeons here that we can help you through this journey to identify if anything needs to go the next step for evaluation.